Hi, my name is Stacy Lerner. This is my clinical presentation for week 7. Some background of this patient. She's a 64-year-old female, Caucasian, urban setting, Chicago, Illinois. Insurance is PPO. So the reason why I wanted to do this clinical presentation was because it took something that normally people or patients, providers look at what's called Botox injections and think of cosmetic uses. So I kind of wanted to break through that and give food for thought for other ways that we can actually use this botulism toxin for really great reasons to help patients. So the patient was told to seek help due to facial stiffness from her Bell's palsy. 64-year-old female presents with facial stiffness from her Bell's palsy. Patient has lived with Bell's palsy for over 1 year and explains how her muscles in her neck have gotten increasingly sore. Patient's primary care provider referred patient to seek help through Botox injections. Patient is open to other options to help her tenderness. Patient denies allergies. So she denies activity change, appetite change, chills, diaphoresis, fevers, unexpected weight change, denies change in hair, skin, or nails, denies headache, sinus pain, facial pain, denies changes in vision, blurry vision, eye pain. She reports right eye dryness, denies tinnitus, drainage, and ear pain, denies drainage, congestion, lesion, tenderness, or trauma, denies hoarseness, sore throat, edema, difficulty swallowing, denies neck stiffness, edema, or range of motion limitations, and neck pain, denies chest pain, palpitations, peripheral edema, denies shortness of breath, cough, chest tightness, wheezing, denies constipation, anorexia, gas pain, nausea, vomiting, diarrhea, and bloating, denies bladder spasm, flank pain, costovertebral tenderness, hematuria, vaginal discharge, denies pain with urination, abdominal discomfort, frequency or urgency, denies excessive thirst, hunger, urination, denies heat or cold intolerance, denies bleeding, bruising, blood clots, or history of blood transfusions, denies tenderness, swelling, or joints of muscles, denies peripheral edema, leg, calf pain, numbness, or tingling of extremities, denies dizziness, gait or balance issues, and speech or motor problems, denies confusion, cognition problems, numbness or tingling, denies rashes or lesions, excessive diaphoresis or dryness or color change, denies anxiety, diaphoretic mood, and sleep disturbances, racing thoughts, agitation or nervousness, denies suicidal thoughts, thoughts of self-harm and harm to others, denies delusions, hallucinations, mood swings, change in appetite, drug use, panic attacks, obsessive or compulsive thoughts, thoughts of dying, and disorientation. So past medical history, Bell's palsy, and honestly there wasn't a whole lot else that she had in her past, so this is really the main thing that we were focusing on. Past surgical history, she had a cesarean section. Her son is now 24 years old. Allergies, no known allergies. Medications, she denies any medication use. She really doesn't like to take any medications, which is why she would like to do an alternative therapy for her pain. Denies over-the-counter medication use as well. Denies alcohol, smoking, drinking, illicit drug use. Her work history, she's a retired 5th grade teacher. She lives with her husband of 40 years in south suburb of Chicago, Illinois. Her mother is alive. She's living with Alzheimer's. Her father is deceased and he had heart disease. Vital signs, temperature 98.4, blood pressure 136/87, heart rate 78, respiration 16, oxygen saturation 100%, height 5'2", weighs 135 pounds. She's well-developed, well-groomed, alert-oriented, appropriate female, and no distress. Normal cephalic hair is healthy and intact, no areas of alopecia, excessive dryness, well-maintained. Right-sided facial drooping is present. Bilateral tympanic membranes are pearly gray with good cone of light, no arrhythmia, bulging, or retractions noted in right ear, bony landmarks visible. Bilateral ear canals are free from drainage. Pupils are equal round, reactive to light and accommodation. Sclera white with blood vessels present. Conjunctiva pink, moist and without drainage. Oral mucosa is moist, no pharyngeal edema or arrhythmia. Uvula is midline and tonsils are present with no evidence of swelling. Oropharynx, color consistent with surrounding tissue. Nose midline symmetrical with no evidence of lesions. Nasal mucosa and turbines pink with no evidence of edema or bogginess. Nares patent bilaterally. Neck supple, no cervical lymphadenopathy, no thyromegaly, no jugular vein distension. Respirations even, unlabored, symmetrical chest wall expansion, no chest wall tenderness, lung sounds clear bilaterally with no adventitious lung sounds, no cyanotic or clubbing of the fingers. Heart rate and rhythm, regular apical pulse, palpable and oscillated, no gallops, rubs, murmurs, or extra heart sounds, S1, S2 present and appropriate, no thrills or bruits present, no generalized or lower extremity edema. Activity, full range of motion of all joints, no tenderness of any joints, no deformities or abnormalities, full range of motion of neck. Abdomen is soft, non-tender, no masses, guarding, rebound, tenderness, or organomegaly. Bowel sounds present in all 4 quadrants. Skin is pink, clean, and dry. No rashes or abnormalities present, no scars. Alert, oriented gait is steady, balance intact, eye range of motion intact, tongue midline, move side to side without deviation, speech clear, cognition intact. Her right-sided facial paralysis is present, which is really cranial nerve 7 that affects Bell's palsy. Affect appropriate, no unexpected distress noted. So for diagnostic testing, we really, I put little stars by the cranial nerves that were tested since it was a dermatology rotation that I had been completing. I didn't do the entire cranial nerve assessment. I just did the main ones that would affect her situation. So oculomotor, trochlear, trigeminal, abducens, and facial. Facial really was the one that you could tell had effect from the Bell's palsy. Differential diagnosis, facial paralysis, Bell's palsy, nerve defect. So our actual diagnosis for this was nerve defect. That's ICD-10 code. So plan, patient will receive Botox injections today in bilateral sternocleidomastoid muscles of the neck. Patient to return to clinic in 3 months when treatment wears off. So there was a lot of education that was provided. We educated the patient regarding Botox injections, the method of action, and non-cosmetic uses of Botox. Patient was worried that this would cause her harm due to hearing the medication was a toxin because it is botulism toxin. We explained how the non-cosmetic uses of Botox help patients with her history, headaches, cerebral palsy patients, and stroke victims. Patient expressed relief and understanding how this was not a cure for her Bell's palsy, but rather a temporary relief. So it could last for 3 to 4 months. Studies have shown that Botox injections help patients who have been diagnosed with Bell's palsy. So the treatment can help with the pain, the muscle spasms, and the symmetry of the face. Patients with Bell's palsy often experience what is called facial synkinesis. Facial synkinesis is described to be unwanted moving of facial muscles due to compression of the nerve. So the reference that I have here at the bottom, that is a wonderful study that I looked at while researching this and the benefits of Botox injections. This woman, they took her throughout time from her first visit to her last visit of the study, and the symmetry of her face is just really incredible. So I urge you guys to look at that. And here are the references. Thank you so much for listening, and I look forward to hearing all of your studies.